My name is Dr. Charlemagne Guerrero. My area of practice is internal medicine, and I've been in practice for 4 years now. I went to medical school at the University of Santo Tomas, Faculty of Medicine and Surgery in the Philippines. And I did my training at Advocate Christ Medical Center, internal medicine program in Auckland, under the University of Illinois Chicago program. Well, being a doctor, it gives me an opportunity to become a healer. And I think it's the best profession in the world, I would say. Internal medicine treats every organ aspect of the body, every system. So it's not just specific to one, one system, like, for example, the heart only. But you also deal with everything, from the lungs, the abdomen, the kidneys, the musculoskeletal system. So basically, I wanted to be more of a rounded physician, that I deal with every aspect of a person's health. I'm actually mainly interested with preventative medicine. Preventative medicine is that before the patient becomes ill, you wanted them to really be on top of their health, give them education. As far as, for example, obesity is a big problem in our country right now. But if you talk to the patient and give them education about, this diet and diet, exercise, and weight management, I think this will prevent a lot of medical problems, like, for example, diabetes. I've done some lectures in the community about preventative medicine, and I would like to continue that one and educate patients about staying healthy. I believe that medicine is an ever-changing field, so you really have to be on top of your toes as far as changes in the clinical practice guidelines are concerned. So I do this by attending grand rounds in the hospitals. I also do continuing medical education, and then I also work with residents who are in training, because with these residents, they ask a lot of questions, so you better know what you're telling them, because it has to be accurate. I believe in what William Osler said before, that a good physician treats the disease, but a great physician actually treats the person who has the disease. And that's what I live by, and that's my philosophy, basically. The rewarding part about my job, I would say, is actually putting a smile on a patient, even though they're undergoing, some discomfort or suffering. And I think that's the best prize, that's the best thank you that I get from my patients, even though they're not feeling well. But once they feel that you're really taking good care of them, you get a smile from them, and I think that's awesome.